All right. Good afternoon once again, everybody, and thank you into dialing into our Ask the Expert Prostate Cancer Awareness featuring Zero Prostate Cancer organization. All lines are muted for the remainder of the presentation, and we'll have a question and answer portion of the presentation at the end, where we encourage you to type your questions in for the presenters. As we recognize Men's Health Month, we're focusing on the importance of prostate health and the role early detection plays in improving outcomes. Prostate cancer is one of the most common cancers affecting men. Both increased awareness, regular screenings, and informed conversations with healthcare providers, it can often be detected and treated early. Today's seminar will provide you valuable information about risk factors, screening recommendations, and steps you can take to protect your health. Thank you for joining us, and please help me welcome our presenter, Zero Prostate Cancer. They are a leading national nonprofit dedicated to ending prostate cancer and supporting those affected by the disease. Through a comprehensive approach that includes patient support, education, early detection, and advocacy, Zero works to reduce risk, improve outcomes, and ultimately achieve a future with zero prostate cancer deaths. The organization empowers patients and families with resources and peer support, mobilizes communities through volunteer engagement and awareness initiatives, and drives policy change to expand access to life-saving screenings and care, especially in underserved communities disproportionately impacted by the disease. Thank you so much for being with us here today, and I'll now turn it over to you guys.
Great. Thank you so much for that fantastic introduction. We are so glad to be joining you. My name is Zanetta Taylor. I am here on behalf of Zero Prostate Cancer, and we have a panel of esteemed guests joining us today. You may see them on your screen. If they can wave to us really quick, you'll get a chance to see them in a moment, and they'll do their own introductions. But to get us started, let's learn a little more about Zero Prostate Cancer and how you can be screened near you. So today, we're going to talk about who we are, what we do, why it's important, some ways to engage. We'll hear from a survivor with us today, Joe, and then we'll take your questions as mentioned. So, as you just heard, Zero Prostate Cancer has a vision where prostate cancer detection is early, right? Support is unwavering and care is accessible to all. Zero's mission is to improve and save lives from prostate cancer through advocacy, awareness, education, and support. Today, you'll hear about how each of those pieces are in your community and how you can interact with that experience. There are some ways that Zero does this with our organization. And a few of those include videos through webinars, town halls like this one. We also have education events like our annual advocacy summit, virtual education summit, and a variety of care partner support events. We also offer online resources through our website, social media, and downloadable materials online, all at no charge. You'll see a few of those in a moment. One of the ways that Zero is at the front of early detection as well as education is through a new tool. We all understand and engage with AI on a day-to-day, and Zero has introduced the first ever text-based AI support platform for prostate cancer, and it is called ZAC. So we are so excited to have new resources always coming to the front to stay on top of where people are and how they're engaging in society. This tool helps at-risk men, patients, and survivors to get real-time answers 24 hours a day, 7 days a week. We have a text message availability that we can put in the chat if you all want to try out Zach and see how it can answer your questions about prostate cancer as well. We also have a tool called 0360. This is a comprehensive patient support phone number line. When you call, a case manager can help provide personalized help for insurance claims, financial assistance, cost of living, and support. And more, right? We want to be holistic when we are thinking about our prostate cancer survivors and caregivers. What is it that they need, right? How can we help get folks to the resources that give them that next step and that help to get to where they need to be in their prostate cancer journey? So 0360 is a fantastic support, and we'll be sure to also put that phone number in the chat for you. Great. I mentioned a few moments ago about the resources that we offer at Zero Prostate Cancer. You see a few of those here on your screen. We know that Black men are disproportionately affected by prostate cancer, and so we have resources tailored specifically to that audience. We know that we have to be diverse in our audiences that we reach, so we do provide materials in Spanish, for example. You can see those here. We also make sure to reach the general larger communities, be that city, rural, or an area near you. And we have materials that have really great infographics with stats like every 2 minutes, a man is diagnosed with prostate cancer, right? 1 in 8 men may be diagnosed with prostate cancer in their lifetime. And so these types of materials are all at no cost to the community to download and share. So, with that, I'm going to turn it over to Phil, who's going to talk a little bit more with you about prostate cancer. And we'll watch a video here so that we can learn more together. Phil?
Zanetta, thank you very much. Good afternoon, everybody. My name is Phil Mendez-Guipoco. Very proud to be the Vice President of Community Outreach and Engagement here at Zero Prostate Cancer. Next slide, please. So let's take a look at the video, because my first question would be, what's prostate cancer, what it's all about? We've got a video we want to show you. Let's take a couple seconds to listen to it, and then we'll come back really quickly.
Whether you're a volunteer, a community member, or you've been impacted by prostate cancer, understanding this disease could help save a life. Let's learn more. Prostate cancer is cancer that begins in the prostate. The prostate is a walnut-shaped gland in the male reproductive system. Did you know that prostate cancer is the second most commonly diagnosed cancer in men in the US? It is also the second leading cause of cancer death in men. The good news is that early detection saves lives. When caught early, more than 99% of people diagnosed with prostate cancer will be alive in 5 years. When prostate cancer spreads to distant parts of the body, the 5-year survival rate drops to less than 40%. Anyone born with a prostate is at risk for prostate cancer, but certain groups may be at higher risk. Men aged 50 or older have a higher risk of prostate cancer. Black men are about 70% more likely to be diagnosed with prostate cancer than white men, and more than twice as likely to die from the disease. Men with a father, brother, or son diagnosed with prostate cancer have a 2 to 3 times higher risk of developing the disease. Men with certain genetic mutations, such as the BRCA1 or BRCA2 genes, have a higher risk. And military personnel are about 2 times as likely to be diagnosed with prostate cancer as the general public. Studies show veterans with environmental exposure to Agent Orange and burn pits have a higher occurrence of prostate cancer. Screening for prostate cancer is done with a prostate-specific antigen, or PSA, test. It is a blood test that measures the level of PSA, which tends to be higher in men with prostate cancer. An additional test, the digital rectal exam, or DRE, may also be done by a healthcare provider as part of the screening process. The National Comprehensive Cancer Network recommends that Black men and those with a family history should begin talking to their doctor about screening as early as age 40. Men at average risk should start the discussion at age 45. If screening shows you might have prostate cancer, your doctor may do a biopsy. In a biopsy, tissue is removed from the prostate to determine if cancer is present or not. If they find prostate cancer, more tests can help show how serious it is and what treatments might work best. To learn more about prostate cancer and Zero support programs, visit zerocancer.org.
Thank you, everybody. So, we're going to have some time at the end to ask some questions, but that was a quick overview on prostate cancer, and some education for us as all. So, folks, if you can, I'd love for you in the chat, if you'd like to answer the question is, do you know someone touched by prostate cancer? I want to just quickly share a story. My dad passed away from prostate cancer about 3 years ago, and he lived with prostate cancer for a long time. And unfortunately, it had ended up spreading throughout his hip area, and he passed away. We had physicians. We did our best to make sure he got into treatment, but unfortunately, he passed away. So for me, it's a very, very close issue to me. And one of the things that's important to me that we also saw in the video was, because I have a family history of prostate cancer, I needed to talk to my healthcare professionals earlier. So when I hit the age of 40, I started seeing a urologist, and we've been on a journey together ever since as well. So please let me know. Let's remember those who are impacted, and it doesn't only impact individuals, impacts friends and families and systems. Next slide. So I want to get a chance to talk about an initiative that we're doing. Now, folks, I want to share this with you because I just want to share. I've been in Chicago for 30 years. I moved from the West Coast to Los Angeles. I came to Chicago in 1996, and I love this city. This is an amazing city. It makes me happy every time I'm here. I love the people. I love what we have, and we're very, very fortunate as well. I live on the north side in the Albany Park neighborhood. I'm a Sox fan, and I really hope our Bears don't go to Hammond, Indiana. Fingers crossed that they don't. But folks, also for all of us, especially this week, I want to let you know that please be careful if you go outside, your friends, family, we've got some temperature things going on. It's going to be pretty hot. So we just want to make sure everybody's nice and safe as well. But as we get back to Blitz the Barriers, I want to share that Blitz the Barriers is the most ambitious initiative in the history of U.S. prostate cancer programs and services. Zero is working with our supporters across the country to invest $20 million into communities hardest hit by prostate cancer. Blitz, as it's also known, is designed to help focus attention on communities that have historically had the highest rates of disparities when it comes time to understanding the risk, getting screened, mortality, and the quality of life outcomes. Everyone, it's time to make prostate cancer too big to ignore and move people who have a prostate to take some action. Next slide. So please take a look at the slide, and I want to just quickly share like big level of visions. You know, despite advances in early detection and treatment, prostate cancer does continue to exact a devastating toll on under-resourced and underserved communities across the country. You heard earlier, Black men, veterans, and rural underserved populations in particular carry the disease's greatest burden. I feel that there's a critical public health crisis. Despite the medical progress, the systemic inequities creates a vastly different prostate cancer outcomes based on race, geography, and socioeconomic status. So the disparities aren't biological likelihood. They're largely driven by access barriers, environmental stressors, and structural inequalities. What stands out to me as I take a look at this slide, and I think about every day when we do the work, take a look at the stat that Black men have a 75% higher risk of being diagnosed with metastatic disease by the time they're diagnosed with prostate cancer. And our military veterans are 2 times likely to be diagnosed with prostate cancer. What we know is that the medical community has known about prostate cancer disparities for decades, right? But it's both systemic and it's medical. It's never one thing. And it'll really require a lot of people and some long-term solutions in order for us to really figure that piece of it out. Next slide. Barriers exist at every point. So whether from screening that we're trying to promote, to diagnosis, to accessing the most latest cutting edge treatments. Zero has made the elimination of prostate cancer disparities central to our mission. But right now, our reach exceeds our grasps. Blitz is going to really help drive more deeply into those communities that are most at need, find local solutions that work, and then replicate them at scales to those efforts across the country. We want to encourage and drive conversations about larger systemic issues. And as I mentioned earlier, there are bigger issues at hand, but we feel our efforts are focused in the right direction. Next slide. So, Blitz the Barriers, what it's about, ultimately it's this. What we want to do is increase prostate cancer screenings with the goal of saving over 100,000 lives over the time we want to have this initiative. We know if we do that, we'll give people more time, more life, and we'll have an opportunity to close the gaps that are currently in place. So our opportunity with Blitz the Barriers when it comes to Chicago and across the country is make sure we increase those prostate cancer screenings, and we'll talk a little bit more about that in a second. But if we could save over 100,000 lives, that will be amazing, and we'll have more opportunities to have people and families live longer together. Next slide. Here are some of the very big tasks ahead of us. Here are some of our goals over the next 3 years of implementation, and some goals that stand out to me include, reaching over 500,000 people with our educational programs, right? Screenings and services for patients. We want to change the conversation about prostate cancer with messaging and awareness to reach over 25 million people through general and targeted messaging. I mean, let me share this also to everyone. we've got to let people know what a prostate is and how it impacts them and how prostate cancer develops in there as well. Even at that very basic level, that's one of those conversations we want to do. We want to drive that PSA screening. At Zero sponsors program events for over 3,000 at-risk community members each year. So we want to definitely do that. And there are many more goals that we're doing, but I want to share as we take a look, as we go into the different markets, as the 12 markets we'll be entering, these are the really big highlighted efforts that we're reaching out to do. Next slide. So, I took a look at our Chicago Department of Public Health and took a look at the Chicago Health Atlas. Don't know if anybody's ever had a chance to take a look at that, but go there, take a look at some statistics. And I just want to share this with you. I wanted to share the top 20 locations from 2017 to 2021 on where prostate cancer diagnosis happened in the city. So take a look at this, see maybe where you live. And I have two questions for us, right? In some of these locations that have people who are diagnosed, the question for these locations, and if your location is not on here, is why, right? In the near north side, why are there over 300 individuals diagnosed with prostate cancer? It could be that they're getting screened, that they're seeing healthcare professionals. It seems like they may have the latest tools to be able to diagnose them. But a question I want you to take a look as we take a look at Roseland, as we take a look at Edgewater, as we take a look at Belmont Cragen and different West Pullman. If our neighborhoods aren't on this list, are people not getting screened? And I want you to think about that. Are they not getting screened? Are they not seeing their healthcare professionals? Those are things we want to ask based upon where you live. So take a look at these statistics. I think this is very eye-opening for us to take a look at. And as we take a look at prostate cancer, it's that opportunity to understand where people are getting diagnosed and treatment, and people also where people are not getting diagnosed, and what we've got to do to raise that awareness, encourage people to get screened, and make sure that they can get, as you saw that statistic, the earlier you can catch it, the better the success that you have. Next slide. So everybody, you heard me talk about Blitz. And I want to kind of share what we're doing. In year one of Blitz the Barriers, Zero really has initiated a local test campaign in the pilot communities to develop really culturally relevant messaging and outreach strategies. So the efforts really allow Zero to gather insight from what will inform the broader national campaign. In addition to our community outreach and engagement efforts, Zero expands our comprehensive national media plan aimed at raising awareness of prostate cancer with a specific focus on those at risks. So over the 3 years, we'll improve prostate cancer awareness, screenings, and access and outcomes for targeted populations, again, to Black men, veterans, and our rural underserved. We're also excited that we had our kickoff in Atlanta in September, and we just had our kickoff in Baltimore not too long ago. So we're starting to get into different communities and really doing our best to educate our communities and people with prostates in those areas. But everyone, we can't do this alone. We have partners, we continue to grow this opportunity, and we have great ones to support us in a lot of different levels. I just want to share some partners that we have as our friends at the Association of Oncology Social Workers, the National Council of Negro Women, Kappa Alpha Psi, Phi Beta Sigma, Chi Eta Phi, and some other health systems also that we have as well. And folks, as we this year in 26, we're also excited to expand Blitz. So we had Atlanta, we launched in Baltimore. We're going to be in other markets, including Washington, D.C., New Orleans, Mississippi, and Detroit. And then next year, we'll be coming to, in no order, Houston, Alabama, the Windy City here in Chicago, Appalachia, and South Georgia. So we'll be coming here, working with people to raise that awareness. You'll see the energy. You'll see the awareness. You'll see us helping move people to get themselves screened. I also want to share this, that we'll also host a variety of different resources and connect people to other health organizations who are supporting a general health for all. So please just make sure everybody, you consider, I don't want you to wait until we're here, consider everybody talking to your physician, ask about that PSA, ask them to include that in the test that you might be already taking, and then they'll be able to support you from there. Next slide, there we go. We're in good shape. So you get to see all the slides we've got going on. Next slide, Zanetta. So I want to thank you very much. You got a peek into what we're going to be doing in our markets and in other markets, but it's really an effort to really raise awareness, make sure people are getting those PSA tests, and then working with our healthcare professionals to move forward and really take care of the health. But we have some exciting stuff. I'm going to hand it over to Ty to talk about different ways you can engage.
Thanks, Phil. So that is next slide. I want to introduce myself, though. I'm Tashiana Edwards. I also go by Ty. I'm on the mission team. So what do? I help manage the full volunteer journey. So from recruitment and training to ongoing support, quality assurance, and making sure that volunteers are recognized and appreciated for all of their efforts in volunteering with us. So I want to talk about a couple of ways that you can volunteer, making it easy for people to get involved in ways that interest them and their availability. So I'll start with advocacy. Some our volunteers help with advocacy work. They advocate for policies, legislation. They can send emails, make phone calls that support prostate cancer research, treatment, and patient access to care. Another opportunity that we have is run walk events, and we'll talk a little bit about that in a second because we do have one coming up in Chicago. This is really good for groups during those events. People support in a variety of ways, like with event day activities, registration, course support, and water stations. I will talk about also mentors and support group leaders. Those are our peer-to-peer opportunities, and with those, background checks are required. But first, with mentors, it's really one-on-one peer support. So our mentees and mentors are connected and they have conversations whenever they're really available. It's really a one-on-one opportunity to support men that are going through prostate cancer and have that individual connection there. With our support groups, it is a group setting instead that are in-person or virtual peer-styled support group meetings. And so those conversations are led by a number of people. Sometimes it is caregivers. So we do have women groups. We have Black men groups, LGBTQAI+, and other groups as well. So that is an opportunity for groups to come together and have conversations. And finally, I do want to talk about our community educators. So I would say, in my opinion, this is our biggest opportunity for volunteers to really go out into the community. We have local health fairs, community events, churches, and share information about prostate cancer and early detection. And so all of these opportunities are on our website. We'll make sure that we link that in the chat for you guys. But we'd love to have you all join us if that's something that you're interested in, and we'll make sure that we link that so you can learn a little bit more details about it too. Next slide, please. Thank you. And so I want to talk a little bit more in detail about our community educators. These are the people that are really going into the community, and that's where we really see a need of people getting more information and resources about prostate cancer. And so, like I was saying before, our volunteers go to health fairs, churches, barbershops, community centers, honestly, wherever people really gather. And it's an opportunity to share information about prostate cancer, answer questions, and connect people to support and resources. I do want to caveat and say you don't have to be a medical professional because a lot of our volunteers aren't medical professionals. And so we do give you the tools during our trainings to make sure we tell you how to engage with people and things to say and not to say when it comes to engaging with people in the community. And this role is really critical when it comes to prostate cancer, especially disproportionately affects Black men, and they are diagnosed at a higher rate after in later stages when treatment is a little bit more difficult. So getting that word out in the beginning is really, really helpful. And so community educators help us when it comes to being in these communities, making sure they're talking with people, their trusted peers a lot of times, and providing that peer-to-peer messaging. And you seeing someone that's going through things, you can a little bit more open to having those conversations. And again, we do provide all the training and materials. We're really just looking for people that are passionate and wanting to be out in their community. Next slide. And so I was saying we do have an upcoming training. We do make sure that they are accessible and flexible, so they are virtual. We do have one coming up August 20th from 6 to 7 p.m. Eastern time. I know you all are in Central, but we're in Eastern. That's where I'm located in Atlanta. But making sure that we do have the opportunity for you guys to attend. There quarterly trainings that happen. They're free, anyone can open. And we do make sure that we have a good dialogue and conversation happening during those conversations. We do have another opportunity for organizations that want to engage a bigger group. Maybe it could be corporate volunteer team, a faith community, or just another community organization, and we offer group training. We ask for a minimum of about 40 participants when it comes to us planning out this training. It takes about 8 to 10 weeks. And we do make sure we co-brand materials. There's really a big value having a cohort, because like I was saying previously, people like to volunteer in groups, and it's really helpful. It gets people going and engaging, and it's good to train together. So that is an opportunity that we do have. Next slide.
Thank you so much, Ty. Fantastic. And so you have heard just so much information today, right? You may be listening in and just, man, I really just wanted to learn more. You may have heard about our 0360 helpline today. You may have heard about Zach, our free 24/7 AI text line. You may have heard the stories of Phil and his family and how he was impacted by prostate cancer and learned more and watched the video. And then you say, well, how can I engage near me, right? You say, well, what can I do in Chicago? And so I'm going to tell you a little bit more about making a difference near you. And before I go into that, right, one of the things I always like to ask people is why, right? Why do you want to volunteer? Why are you volunteering, right? Why are you listening to this message today? Maybe a friend or a family member talked to you about prostate cancer and you just clicked just to see, and get more info. Maybe you love serving, right? And you just want to help others near you and do good in the world. That's a great reason. I know for me, I have a husband and 2 young boys. And when I hear about all of the information that you may have heard today, I say, man, I can't sit back, even though I don't belong to the audience who may be affected by prostate cancer, right? How can I help? How can I be an ally and an educator in this space? Well, one of those ways is our upcoming Chicago Run Walk. And so volunteers are great to help assist with cheering on folks, right, who are running or walking and celebrating their survivorship or honoring a loved one who may have been lost to this disease. This event is September 26th, 2026, and it's early, right? It's a run walk. And so we'll get out there at 6:15 in the morning. You'll meet the fantastic Zero team members and really get into your role. You could help with registration, water station, even in some of our post-event celebrations are really great. And so there's lots of roles that you may be able to choose. This one is at Warren Park. So if you know where that is, it's local to Chicago, and we do have a virtual sign up here. Feel free to scan the QR code on your screen if that's something that you're interested in signing up for. Great. You may be in the group who says, well, I really need to probably find screening, right? I may need to see if there's a screener near me. So Zero has a free tool on our website where you can find a screening location near you. You just type in your city or your zip code, and you can choose the distance that you'd like from your location, and you can find a screener near you. You also can ask your doctor, right? Is this something that you offer? Can I be screened? Do I qualify? We always recommend that you speak to your medical professionals about next steps for your specific care, right? Every person is different. So please take time and talk to your medical professionals about what you've heard today. As I mentioned earlier, we have lots of resources. We want to make sure we give you those and allow you to take some next steps, right? So as Ty mentioned, if you know someone who'd make a great volunteer, whether that's you or a HR professional, a team manager or leader, you say, hey, this would be great for our team to try. Can we do this? It may be asking if your company gives time off to volunteer, right? Is that something approved that you can use PTO for or volunteer hours time for? If you want to learn more about our volunteer opportunities, or if you want a group training, we have a link here where you can schedule time to have these conversations about your interest, or you can just visit us at zerocancer.org/volunteer, and our emails are there for more contact after this call. So with no further ado, I want to give some space to Joe Dooley, who is a fantastic Zero volunteer advocate and prostate cancer survivor himself. I would love for you to hear his story. Zach, feel free to take it away.
Okay. Hi, I'm Joe Dooley. I am a 65-year-old guy who lives in Cook County. I'm a prostate cancer survivor, and as Annette said, I'm also a volunteer patient advocate with Zero. I first was diagnosed in 2019 on my annual physical exam. I was 58 years old, going on my 59th birthday. At that point, my PSA blood test, which is just a simple blood draw, came back. And I've been doing it annually now for about 13 years. Around 45, I started. 2019, it was 4.2, which is an abnormal, slightly elevated above 4.0 is considered, at that time was considered abnormal. And I looked at my prior year was a 2.75, and I and my doctor were concerned at the rapid increase, which is something you should look for with prostate cancer, is how much has your PSA increased over a short period of time. If there's a rapid increase, that's concerning. That got me to a urologist, a specialist in prostate cancer, who then said you're a candidate for a biopsy with this rapid increase and the abnormal level. So we did the biopsy, and I came back with a diagnosis of a Gleason 6 prostate cancer inside the prostate. There were no symptoms for this. When prostate cancer sits inside the prostate, you aren't going to feel a thing unless it's a large tumor pressing on your urethra, and you might have some issues with urination. If it's just the cancer cells or small tumor, not even anywhere near the urethra, you're not going to feel a thing. The elevated level of 4.2 could be prostate cancer. It also could be a benign condition called prostatic hypertrophy, which is just a fancy name for enlarged
I think Joe may have had some technical
mine.
difficulties.
Mine turned
Oh, there
out
he is.
to be cancer, and it was this Gleason 6 prostate cancer. The doctor at that time offered me something because that's the low risk, slow moving prostate cancer. He said, this one we can watch, and he offered me active surveillance, saying maybe I'll need surgery down the road, but I could either do it now or we could wait and see if I ever need it in the future. And but we'll do another biopsy in 6 months. Well, my next biopsy ended up being 8 months later, and unfortunately came back as a Gleason 7 prostate cancer inside my prostate, which is an intermediate risk level, and one where you need to decide, are you going to have a prostatectomy or have radiation treatment inside the prostate of that cancer. I chose prostatectomy, which was done 60 days later after that biopsy. The prostate came out. It was a robotic surgery. That was the way they take the prostate out now. So it's a nerve sparing surgery, which they try to spare the bundles of nerves that are there for your erection function. It's also better surgery now with the robotic surgery to protect you from urinary incontinence, which are two risks of this surgery, especially in the past when they're doing big open procedures, but not as high of a risk now. Men are coming out with continence, in other words, able to hold their urine, not leaking or having bladder problems. They might right after surgery, but not for a long period of time. For me, when they took the prostate out, unfortunately, at this time, they found a positive lymph node, meaning that I was now a stage 4 cancer patient with metastatic disease. The cancer was outside the prostate. It had broken through the wall. This is why I become an advocate, is because I don't want other men to go through this. Had I taken that prostate out earlier, while the cancer was contained within the prostate, I would be 100% cured. The doctors will say you have like a 99% cure rate if you get the prostate out with all the cancer contained in it. You know, it's 99 to 100% cure rate. Now I have had stage 4 metastatic disease, which required what they call androgen deprivation therapy, which means they take away all of your testosterone with shots, because prostate cancer feeds on testosterone, and this slows it down, puts it to sleep, so that they could do further treatment with radiation. At that point, there was also actually largely through Zero, and there's some of the research that they've supported and worked on, there was a new technology that came out in 2020 called a PSMA scanning, and that's available now in Chicago. It's pretty standard of care now for diagnosis of men like me, where that cancer is. Is it still inside the prostate? If it gets out, where is it? Outside the prostate, it's the way they send in radioactive nuclear material through your bloodstream, which will sit on the prostate-specific membrane antigen of the cancer cell, and it will light up on a PET scan. And my doctor wanted to put me in this clinical study to see if we could find it at a very, very low PSA level of 0.25, because after your prostate cancer metastasizes, even though the prostate is gone, you still have the PSA level because the prostate cancer cells are kicking off the PSA level. So this low level, he was able to find my very small tumor sitting there in the seminal vesicle bed right above where the prostate was. And we treated that with radiation for 8 weeks. And then it was targeted for that tumor and the area around it. And then also with the hormone therapy for 18 months. And that lasted for 2 years. I had no testosterone. But the end result of this whole story is that in last year, in November of 2025, he said, let's do a full body PET scan to see how you're doing, even though you have had a 0 PSA since you went off the therapy and you have had your testosterone return. There's still a chance that the cancer could be in your system. There's a 12% chance. So we did the scan, and I have no evidence of recurrence or metastasis. But in September of last year, and actually in the summer of last year, I started to try to advocate for the position of early detection and treatment to avoid going through what I went through. And I'd start out just talking to my friends who all wanted to know about it. And then I'll start putting out some videos and podcasts, that sort of thing. And I found Zero in September of last year, and found out they have the exact same mission that I was trying on my own, was to get the word out for early detection, to get the word that you heard today about get that PSA screening, know what your test result is right now, know what it was last year, know what the levels are that are abnormal, talk to your doctor about it, see if you need further testing with biopsy, MRI, and all those various scans that they offer, and various blood tests in addition to just a simple PSA test to see whether you have cancer that needs to be treated before it metastasizes, or has it metastasized, what are the next steps. And I think what they do at Zero is so important. So I joined. I've been on in Washington, D.C., meeting with congressional staff and congressmen to try to get more prostate cancer research money for our veterans, for all of us, including the general population. Then at the state level, I haven't done anything yet, but I plan to. But in the state of Illinois, Zero did a great job. We're one of 2 states, New York being the other, that because of the advocacy that this organization has provided for all prostate cancer patients, in Illinois, you can get PSA screening with no copay, no co-insurance payment, no deductible. So in other words, free screenings throughout the state of Illinois. And if you're uninsured, Cook County did the same thing that Illinois did. So for our uninsured patients, we're going to have free screening at all of the county hospitals and clinics. So the screening is free. It's just a blood test. And it's something that every man should do. If you're, as you heard on the discussion on these slides, if you're a Black man or you've had a paternal history with your father, your uncle, or your brother, you should get screening at the age of 40. The rest of us I had it on my father's side. I didn't know that till I was past 45. So he didn't have it until I was past 45. So I didn't start at 40, I started at 45. But for everybody, you should start at 45 to get your baseline and learn what your PSA score is. If you're Black or have a paternal history, you should start at age 40, and know that if you're below the age 60, MD Anderson, which is a big cancer hospital in Houston, one of the best in the country, came out and said through their study, 2.5 is an abnormal score below the age of 60. Above the age of 60, 4.0 is abnormal. So those are the numbers you're looking for. And I would be happy at the end here to answer any questions that anybody has, and I hope that covered what you wanted to hear, Zanetta, from me. I'm happy to answer any questions.
That was great, Joe. Thank you so much. Dakota, I think this concludes our presentation. We wanted to take some time just to open for any questions with the folks who are joining us. So if you would like to raise your hand, we may be able to see you or come off mute. Dakota, you may have some more presentation allowances than we do. Thank you so much, Joe, for sharing your story.
Yeah, thank you very, very much for sharing all that. I mean, it's even something like I'm just turned 31. Still something that I'm always thinking about. You know, just I think it's always better to, like you said, just kind of just to know, especially if we do have a family history. If we do have any questions, comments, or anything that you'd like to ask our presenters here, please feel free to type that in the chat. As always, you know, if it's something related to wellness, you could reach out to myself, wellness@transitchicago.com. But definitely please take this opportunity, type those messages out. If you don't want to type them out to everybody, you can send them to me or the presenters direct. But we'll just take the last couple minutes here just to wait for any of your questions.
Awesome. I will note that sometimes after you need some seconds to process, right? Sometimes you need a minute to kind of digest it, like Dakota mentioned. And so after the call today, or if you're watching this recording, you think about a question, feel free to reach out to the team, Chicago Transit Authority, or us with our emails here. We will get those questions and feel free to get you all answers. Thank you again, Dakota, for having us.
Yeah, of course. Thank you guys so much for being here and sharing, you know, your stories, your information. It's all incredibly important. And I do want to mention to everybody who's listening that CTA does always do a team for the walk every year. So stay tuned for that messaging to come out from the wellness team. But as always, you know, we encourage you for those walks to bring your friends, your family, neighbors, anybody that you know that would be interested in joining us on our walk. Please feel free to sign up for it. Be on the lookout for that, as I said. But if we don't have any more questions or anything in the chat, looks like we don't have nothing yet. I just want to wish you all a wonderful week. Definitely to echo what was said earlier, keep an eye on that heat, stay hydrated, you know, find ways to cool off if you can. And definitely, you know, always practice wellness in all of its forms. So thank you so much, everybody. Our presenters, thank you very much once again, and have a wonderful rest of your day.